I'm Dr. Joel Weinthal. I am a pediatric hematologist based in Dallas, Texas. And I've been interested in Gaucher disease for over 30 years and have been taking care of patients and doing research both in the laboratory and clinical trials. So sometimes patients are referred to me already diagnosed. Sometimes patients are suspected to have Gaucher disease and are sent to me. And then other times I am someone who patients are sent to me just for a little assistance in taking care of them. So it's sort of a multi-dimensional role. One of the things I think about Gaucher Awareness Month is not only for the general community and the general LSD community and Gaucher community, but is also in educating my colleagues and fellow physicians to be aware of Gaucher disease. Because unfortunately, even hematologists don't always think of Gaucher disease because it is a very rare disease. So we go through our differential diagnosis with certain symptoms, ruling out many other things. And what my sort of take-home point is always, if you've ruled out everything else, it's still got to be something. And that something might be Gaucher disease. So that's often my role in saying, okay, if it might be Gaucher disease, let's test for it. The most important thing for hematologists, again, as I mentioned before, is to think, gee, it's not leukemia, it's not ITP, it's not another malignancy, but the patient does have a spleen that's palpable. They do have blood counts that are not normal. So what can this be? It has to be something. So I think our key challenge, and really what we need to do for hematologists, is to make them think it could be Gaucher disease. Because working up Gaucher disease is so easy. But, if you're a practitioner and you've never seen a Gaucher case in your practice, or you've seen one 25 years ago, you're not really going to think about it. So it's just raising that awareness to say, what else could it be? So I think that's really the major thing we have to do for hematologists, is get them to think of Gaucher in their differential diagnosis with the common symptoms. So it's just thinking of it and just putting it in your differential. And that really is I think the most important thing, because unless a so-called diagnostic specimen is obtained, I think pathologists might say, this could be a storage disease, or this could be something that might trigger the sort of pathway of doing the workup. But the problem is that when they talk to the physicians who either did the test or involved in the care of the patient, it might not always lead to, oh, you better do a Gaucher test. And that really is, I think, our big challenge, is to get that test done, to know to do that test.
Hi, my name is Dr. Alberto Santiago-Cornier. I'm a clinical and molecular geneticist. I'm also the chief of genetics section at San Jorge Children's Hospital in San Juan, Puerto Rico, and I'm also a professor at the School of Medicine in Ponce Health Sciences University and University Central del Caribe School of Medicine in Puerto Rico as well. I think it's extremely important to create awareness of the disease like any other rare disease, but Gaucher disease is one of those disorders that have such a much better prognosis if you can diagnose it as early as possible, and so forth. It's very important to create awareness, not only from a medical point of view, because you will be able to provide these patients with the appropriate care and management, but also from a patient's point of view. This is a chronic disease, and so forth. These people have to live with this disorder for the rest of their life, and the earlier and the more awareness you create, the more support system that these patients will be able to create, and we as healthcare professionals will be able to provide them with the appropriate referrals, such as therapies, the physical therapy, psychologists, social workers, nurses, et cetera, et cetera. So I think that awareness is practically the most important thing. One of the problems that we have with Gaucher disease is that most people do not know what it is. So by creating awareness, not only we're helping healthcare professionals, but the patients. We are not exposed to a lot of rare diseases in medical school, and certainly not a lot of Gaucher disease basic training in medical school. So that's where it starts. It's a complex thing. It should start from the medical school, but we need to create more awareness by providing more disease awareness lectures and include these topics into the different medical specialties meetings throughout the world. One of the challenges of Gaucher disease is precisely the variable presentation of it. The other thing is that it may mimic many other very common disorders. It's a very easy diagnosis to make once you have it in your mind, once you consider as a possibility in your differential diagnosis, because it's a very straightforward enzymatic test that you do. Gaucher disease can vary a lot, and there are some patients who have a very mild presentation of Gaucher disease, and this is one of the reasons that it can take many years to make a diagnosis, because we may have very mild thrombocytopenia or very mild anemia, and it can be attributed to many other things, but Gaucher disease. The earlier you diagnose a patient and the earlier that patient becomes treated if needed, then the more you will prevent possible complications. I had a young patient. She was 14 years old when we diagnosed her with the Gaucher disease. Unfortunately, she had been admitted to the hospital 2 or 3 times a year with bone pain since she was 9 years of age, and no one knows what that pain was from. And they did many studies, and by the time she came to genetics, she already had a vascular necrosis of the femoral heads, which probably could have been prevented if we would have diagnosed that patient earlier. I think that the most important thing that we can do to improve the diagnosis and early diagnosis is awareness, is create awareness. I think that primary care physicians should create more awareness and work with the genetic setting that they have in their area in order to make a prompt diagnosis and certainly do the test. I mean, it's so easy. You can even do it on a dry filter paper. So it's very straightforward. It's cost effective. It's very accurate in diagnosis. So geneticists should be more actively involved with their communities in spreading the word of these rare diseases. And Gaucher disease is one of them. Gaucher disease has been very close to my heart. My early beginnings as a genetic fellow at a children's hospital in Boston. My first patient with Gaucher disease, she was 12 years of age at the time when we diagnosed. So she has severe or massive splenomegaly. She had bilateral necrosis of the femoral heads. So she was severely affected even when she was only 12 years of age. 26 years later, we still keep in touch. Every Christmas, I receive a Christmas card from her. She's now a married lady with 4 children. And every time I go to Boston, we have lunch together. So Gaucher disease is one of those diseases that your patients become part of your extended family. And I think that's the way every physician should approach any disease. But for me, Gaucher disease is that important. I'm still in touch with my first Gaucher patient of 26 years ago.